warm welcome. I'm Kumuda. Everyone curious about the topic the rest of us going to explain, aren't you? So, let's start with a quick question. Are you an extrovert who likes crowded environment or an introvert who loves to stay in a deserted surrounding? If you are the second one, then you will love this topic. And if you are the vice versa, then be prepared to know about keeping your distance from people around you, which is social distancing. Social distancing, also known as physical distancing, is a public health measure aimed at reducing spread of infectious diseases by limiting close contact between people. This concept is not new, as it has been employed during various outbreaks such as COVID-19, which just happened in 2020. Well, to be more precise, social distancing practices always has been in practical use, such as hospitals. So, what do you think the effect or the causes that occurs from practicing social distancing, whether it is good or bad?
Hi sir, my name is Priyavatri, Doctor of Kaliswaran. My metro number is 4233002411. Now I'm going to talk about effect of social distancing. The effect of social distancing is reduced spread of COVID-19. COVID-19 is primary spread from person to person via the when a person infect, cough, speech, even breath. Social distancing aims to prevent this spread by reducing close contact between people. It may sound inconvenient, but it is social responsibility we should all take it seriously. That and making sure you are wearing face mask in public and practicing proper hand hygiene and proper cough etiquette. Social distancing can include large-scale measures like cancelling crowded group events and closing public, but it also includes an individual effort from each one of us to practice the measure that help prevent the spread of COVID-19. The second point is impact on learning and growth. During the COVID-19 pandemic, impact on collaborative learning as educational online means reduced opportunity for teamwork and students are not able to share their problems to the colleagues, can affect the development of social and interpersonal skills. After that, teachers have to adapt their teaching method to accumulate social distance guidelines. This may involve creative solutions such as visual classroom, recorded lecture to maintain engagement and facilitate understanding. While these methods provide flexibilities, they can pose challenges such as digital divide, varying internet access, and need for students and lecturers to adapt the new technologies. The physical separation imposed by social distancing measure can contribute to feelings of isolation and loneliness among students. Because at home, learning affects students differently. High achievers likely have an easier time staying on track because they try to pick up new concepts faster. But low achievers might struggle without in-person teaching guidance and group activities. It also the student becomes stressed and depression. Teachers may also find it challenging to cope and address the emotional well-being of their students.
The social distancing during the COVID-19 pandemic has brought many changes to our life. Social distancing is the most visible public health response to the COVID-19 pandemic, but its implications for mental health are unknown. Stay-at-home order status and personal distancing were independently related with higher symptoms. True quarantine or total isolation to contain an illness has been shown in studies to have significant consequence on distress and mental health, including depression, insomnia, anxiety, and post-traumatic stress. Some people have increased their use of alcohol or drugs, believing it will help them cope with their anxiety about the pandemic. There have also been affecting evidence increased suicide thoughts and behaviors, especially among the healthcare workers. Some group of peoples have been affected much more than others, which can fuel feelings of anxiety, uncertainty, and loneliness. For some children and adults, made to being at home may have increased the risk of family stress and abuse, which are risk factors for mental health problems. In reality, using this substance can worsen anxiety and depression. Besides that, social distancing is also affect a person's physical health. People who are socially isolated tend to exercise less, sleep more poorly, and consume more dietary fat. It is important to keep in mind that physical activities and exercises not only promote physical or psychological health, but also help our bodies respond to the harmful effect diseases such as diabetes, hypertension, and cardiovascular disease. To avoid weight gain, humans should engage in at least 150 minutes of moderate physical exercise per week. It is important to remain physically active by frequently walking and cycling, whether recreationally or practically. Otherwise, it is likely that the total amount of physical activity will drop for most people, possibly resulting in increased level of obesity, diabetes, and cardiovascular disease. Mental and physical health issue is a major effects of social distancing. I'm passing this to Sangeeta to brief more about causes of social distancing.
Good day, ladies and gentlemen. My name is Sangeeta Nathan, and my metric number is 42233004141. Today, I'm going to talk about causes of the social distancing. In the face of contagious diseases, the adoption of social distancing measures has becoming a defining aspect of our daily lives. Today, I want to delve into a crucial factor that drives the behavioral shift, which is the pervasive fear of infection. At its core, the fear of infection is deeply personal. It stems from concerns of our own safety and well-being. But it goes beyond the individual. Our fear extends to our loved ones, our family, friends, and vulnerable individuals within our social circles. Social distancing becomes a responsible, proactive measure to safeguard those we care about, a shared commitment to the health of our communities. Media plays a significant role in shaping these fears. This constant barrage of news, statistics, and images can create sense of urgency, amplifying our concerns. Social distancing then becomes a tangible action based on information available to us. A response to the perceived threat that we see is our social norms and peer behavior also influence this fear. Observing others practice social distancing or discussing their concerns can influence our own actions. It becomes a collective response, a shared effort in managing the threat we all face. By understanding the intricate relationship between our fear of infection and the adoption of social distancing measures is crucial. As we navigate these challenging times, let us address these fears with clear communication, empathy, and support. By doing so, we can contribute to more effective and sustainable adherence to the preventive measures that shape our shared path. Thank you.
Ladies and gentlemen, today I want to emphasize a critical measure in our battle against COVID 19, which is social distancing. Governments worldwide have implemented policies rooted in the urgent need to curb the virus spread. One primary cause is the imperative to protect vulnerable populations such as the elderly and those with pre-existing health conditions. Another crucial factor is the strain on healthcare system. Social distancing used as a tool to flatten the curve, ensuring hospitals can effectively manage patients' load and provide necessary attention to each individual, reducing the overall burden on the system. Moreover, these policies address the vital need for controlling the transmission of the virus. By limiting social interactions, authorities aim to break the chain of infection, protecting individuals and preventing healthcare systems from becoming overwhelmed. In addition, the implementation of social distancing is driven by the necessity to buy time for medical research and vaccine development. Restricting the virus spread allows scientists and pharmaceutical companies the opportunity to study the virus, develop effective treatments, and produce vaccines to bring an end to the pandemic. In conclusion, the causes behind government policies on social distancing are firmly anchored in the collective responsibility to safeguard public health, protect the vulnerable, maintain maintain healthcare system integrity, control virus transmission, and expedite scientific advancements. These measures are not just about our safety today, they are an investment in a healthier and more resilient future for all. Thank you.
In conclusion, social distancing is a crucial public health measure that has been employed during various outbreaks to reduce the spread of infectious diseases. While it has been proven effective in reducing the rate of close contact within populations and decreasing human mobility, to social distancing guidelines can lead to social distancing fatigue, which may impact the effectiveness of this measure over time. So, let's be humans, normalize social distancing in our daily life. Thank you.